You guys are hardcore. I've decided after 25 years you have to be relentlessly optimistic to stay in healthcare and health policy. And after the depressing lunch conversation, I have decided after the day that there is something that every tribe, every partisan side of the aisle agrees on, is that healthcare costs too much and we have to do something about it. And I would say that is particularly true for my members. And so sort of why do employers care about healthcare? They're paying for it. They're paying for about half the healthcare in this country. And they are actually truly committed to the health and well-being of their employees. And so I get a lot of questions sort of, well, where are they? Why haven't they done more? You know, they're like mythical creatures, Bigfoot, Loch Ness Monster. Where are they? We know they're out there and they care about this. I will tell you that they are absolutely engaged in paying attention, and they are going to drive change if nobody else does. So I am really pleased to just be able to share with you some of the strategies that my members are taking on. And employers are not monolithic. We have low-wage retail employees to the high-tech employees who have cappuccinos delivered at their desk. They are different populations and different priorities, but the ones who have joined the Pacific Business Group on Health are committed to truly transforming the healthcare system. So with that, who we are, we have about 40 members, and they are both private and public. So we have CalPERS, we have the UC system. The chair of our board is Walmart. We have Boeing. We've got Intel. So it's a wide range of employers, and they spend about $100 billion a year on healthcare, representing or purchasing on behalf of 15 million Americans. And where we are focused collectively is advanced primary care, truly improving the foundation of the system through advanced primary care, which includes integrated behavioral health. Purchasing value, so not paying for wasteful services, and we're going to talk a bit more about that. And then functional markets. We have a policy arm. We are very active federally. In fact, we're on the Hill more often than I care to admit. We got to testify on the Lower Healthcare Cost Act this summer. And I just want to call out how bad things have to be in healthcare when the largest private companies in the world are seeking congressional intervention. I mean, just think about that. These are private market proponents, and things are so bad, whether it's drug pricing, surprise billing, anti-competitive practices, that they are looking for help from Congress. So that's quite a condemnation. Now, I actually don't have to share these because it seems like everybody has had slides like this today. But when we talk about social determinants, and most of my employer members don't really talk about social determinants, they'll say, we know that our employees are sleeping in their cars. We know that our employees can't come to work because they can't find a place to live. So they are understanding what is needed and that their employees are suffering, and a lot of the money that could go to other social needs are going to healthcare. And research shows that about 10 years of US wage growth has been lost to healthcare inflation. This chart came out this week from Niall Brennan, and remember Uwe Reinhardt, it's the price is stupid, it's the price is stupid. They are not providing more services, they are not providing higher quality services, they are simply charging more. And I think this has absolutely gotten the attention of large employers. You remember the RAND study that came out that showed that they pay on average 240% more for the same hospital service, sometimes up to 700% more. That got their attention. And they are now asking us to send their data in to be part of the next study. So they watch this space. This is not going to go unchallenged going forward. And again, voters are demanding change. You've heard it over and over. And that means that these employees in these companies, that those are the same people. But what's different is that employers, I believe, are now stepping up and saying they have to do something. The market, the system has not fixed itself. We worked on collaboration and partnerships for a long time. We thought that this would take care of itself, that it really shouldn't be on the customer to actually fix the system. Think of any other industry. If Apple came out with a bad iPhone, which they wouldn't, of course, or GM produced a bad car and they said, well, the customers can tell us how to make it better. That's sort of the ask of employers. Well, you're paying for all this, give us better incentives or give us better measures and then we'll do it. So what we're hearing, and again, Lisa Woods is actually my board chair, that as they continue to rise, as costs continue to rise, they're working to ensure that providers and intermediaries are providing quality and value, but if not, they're going to take action. And I think that's really the frame that we are working within. So what have we done, right? It's one thing to complain and point out the problem. What we are trying to do at Pacific Business Group on Health with our members is actually do something about it. So I'm going to show just a few examples of some of the strategies that our members have committed to. One thing is a program that we operate with our TPA partner, which is called the Employer Centers of Excellence Network. It was actually created by Walmart, Lowe's, and McKesson and brought to PBGH for scaling. And these results, these were actually published in Harvard Business Review. They're not just us saying this. Through this Centers of Excellence program, they were able to reduce readmissions by about 50%. They found that about 50% of the folks who were referred for surgery didn't need it. They were being prescribed unnecessary procedures. And yet when they were treated in the Centers of Excellence, outcomes were remarkably higher. Patient experience was the best they'd ever had, and the savings on total cost of care was dramatic. So they proved that it is true, better care can cost less. And they are focused on quality, they are focused on outcomes and experience, but when they can get that all to work together and reduce total cost of care, that's a real win. Something else we're working on, and this is actually our work in California, supported graciously by the California Healthcare Foundation and others. We are a federal contractor and we run QI programs in California. And we just wrapped up a 4-year project, and by working directly with small practices and coaching and giving them data and information, we were able to achieve, and this was quantified by CMS, $345 million of savings. And that was through the right care. We reduced utilization that wasn't necessary. Avoided ED visits, 67,000. 59,000 avoided hospital admissions. And this is just from us. We're a small nonprofit working directly in the field, partnering with other plans, but this is doable. And this is the right thing for patients, and it saves money. Another thing that we've been working on, you've heard about it a lot today, is pharmacy spend. And what we did, we actually took the claims from 15 of our members and we evaluated them and found that there was a 3 to 24% reduced savings if we actually had the right formulary with the right PBM. That's real money when you're spending $100 billion a year. And we are now working directly with some of our members. Levi's, they asked their employer their health plan to actually look at the opportunities for savings. They didn't get anywhere. The PBM didn't give them anything. We actually helped them find an auditor. They came in and within 6 weeks, they found $20 million of savings. Another one of our members, USC, right nearby, they actually hired a pharmacist to come in. He represents USC as our member. And they looked at their formulary. They realized that there was a 40% savings opportunity. Their PBM refused to do it, so they found another one. They are actually taking action and making significant savings. And then finally, some of the things that we've been working on are really these direct contract ACOs. There is a frustration with some of the intermediaries that haven't delivered the quality and value that these large employers expect. And so they're going direct. Now, Walmart, Intel, Microsoft, and there's several others over here, they are really looking at how to intervene in the system. They tried sort of cost shifting with consumer-directed plans. They've tried pretty much everything else, and they have really concluded that they have to intervene much more directly in the system. So this is what we're working for. We're not just sort of doing projects. And you did not miss these headlines, I promise. But we think that if we are successful, this is possible. And there was a headline like this actually in a state where Geisinger actually reduced costs so much they were able to give their teachers an $8,000 raise. That's the win. We reduce costs, we make care better, and we share it with employees. So we're going to continue to work on payment reform, measure alignment. We're absolutely working hard on that in California with Covered California and CalPERS and others. We're going to be scaling the innovations that we have. We're going to be continuing the selective and direct contracting. We're also looking for new market entrants, new TPAs, new PBMs that can do things differently and be more responsive. And then we are working very closely with policymakers on the Hill from everything from surprise billing to, again, drug prices. And just really briefly, we are leading something called Employers RX. It's an advocacy initiative around drug pricing. You may have seen some of it, but we are actually getting some real traction because some of these practices are indefensible, and employers are finally calling them out, and they are really making their voice heard. You may have heard about this lawsuit recently. So PBGH was actually very involved behind the scenes running the data. We actually worked with some of our members. They started to see a 70% price variation from Northern to Southern California. And they asked their plans, what is going on? And the plan said, sorry, we can't tell you. Gag clauses, all or nothing tiering, network design that you have to put a system in the highest tier regardless of the quality. The employers are not going to be tolerating that anymore, and they literally just on Tuesday, they voted to have PBGH expand this work and actually take it nationally because they have employees all over the country. They're facing consolidation all over the country. They want to figure out how we can take these lessons and really change the market elsewhere. And then we will continue to work on advanced primary care. We're going to be working on how do you truly integrate behavioral health. That is the top request from all of our members. And then finally, we just launched in January something we're calling the National Health Plan Playbook. And you think the employers won't work together. 15 of the largest employers in the country signed this playbook and authorized PBGH to work directly with national health plans to go in a shared direction. Investment in primary care, investment in behavioral health, investment in maternity care. These are the things that they are starting to ask for. This is a living, evolving document. We will continue to actually raise the bar, but they're no longer sitting back and just letting it happen. And then finally, we are going to be scaling our work with other large employers who are really, truly trying innovative approaches to making care better. So the giants are woke. They are really, they have to do this. They are doing this on behalf of their employees and frankly on behalf of the US economy. And they're willing to partner with everyone to make it better. Thank you.